Welcome to Rich Planet TV. I'm Richard D. Hall. Now I'm going to start with a quick appeal. I'm appealing for anyone who lives in either North or South Carolina in the United States who is willing to drive and make a few inquiries on my behalf. If you think you can help, please get in touch at richard@richplanet.net. I'm announcing details of a new book and film that I'm producing about the 2017 Manchester Arena bombing. The book or DVD can be pre-ordered from the Rich Planet website. They will be released in early April 2020 on the Rich Planet tour. Today I am going to be discussing the groundbreaking medical discoveries of Dr. Ryke Geerd Hamer. Dr. Hamer was born in 1935 in Germany and died in 2017. In 1972 he specialised in internal medicine and was in charge of cancer patients. In August 1978, Dr. Hamer received the shocking news that his son Dirk had been accidentally shot by the Italian prince Victor Emmanuel of Savoy. Then in December 1978, Dirk succumbed to his injuries and died in his father's arms. Shortly after Dirk's death, Dr. Hamer was diagnosed with testicular cancer. Since he had never been seriously ill, he postulated that the development of his cancer could be directly related to the unexpected loss of his son. In fact, he would eventually, in honour of Dirk, call this unexpected shock a DHS, or a Dirk Hamer syndrome. Dirk's death and his own experience with cancer set Dr. Hamer on an extraordinary scientific journey. At the time, he was head internist of a cancer clinic at the University of Munich, where he began to investigate his cancer patients' histories and soon learned that, like him, they all had experienced an unexpected shock of one sort or another. But he took his research even further, pursuing the hypothesis that all bodily processes are controlled from the brain. He analysed his patients' brain scans and compared them with their medical records and personal histories. To his amazement, he found a clear correlation between certain types of conflict shock and how these shocks manifest themselves on the organ level as specific symptoms, and how all this is connected to the brain. Until then, no studies had examined the role of the brain as the mediator between the psyche and a diseased organ. Dr. Hamer established that every disease originates from a shock or trauma that catches an individual completely by surprise. The moment the unexpected conflict occurs, the shock strikes a specific, predetermined area in the brain, causing a lesion, visible on a brain scan as a set of sharp concentric rings. The brain cells that receive the shock, or DHS, send a biochemical signal to the corresponding body cells, causing the growth of a tumour, or a meltdown in tissue, or functional loss, depending on which part of the brain is involved. The reason why specific conflicts are irrefutably tied to specific areas in the brain is that during the development of the human organism, each brain area was programmed to respond instantly to situations that could threaten survival. While the brainstem, the oldest part of the brain, is programmed with primordial conflicts relating to breathing, i.e. death fright conflicts, reproduction, i.e. procreation conflicts, and food, i.e. morsel conflicts. The cerebrum, the youngest part of the brain, correlates to more advanced matters, separation conflicts, and territorial conflicts. Dr. Hamer also discovered that every disease progresses in two phases. First, a conflict active phase, characterized by emotional distress, a lack of appetite, and sleeplessness, and then, provided the conflict can be resolved, a healing phase. This is the period in which the psyche, the brain, and the affected organ undergo the phase of recovery, an often difficult process marked by fatigue, headaches, inflammation, infections, and pain. Today I am joined by a couple who have studied Dr. Hamer's research and recently returned from a trip to Austria, where they attended a 3-day international training conference learning about the work. Welcome Danielle and Lloyd Bryant.
Hi.
Thank you, Richard.
It's good to have you here. eventually. Now, you two have been interested in alternative medicine for quite some years now, and you run a business, a small business, selling alternative health products. So just tell us about how you came to be interested in alternative health first, and about Shop Holistic.
Okay, yeah. So Shop Holistic now has been running over 15 years. We kind of specialise in niche health products that you don't really find in the supermarket. And we kind of specialise in high potency maybe things, which in recent years has been more difficult because of EU regulations and the like. So I mean, I'm a computer programmer by trade. Danielle does a number of therapies. She's also an author. She's written a book. And so yeah, we've researched part of our shop, or our general interest in alternative health matters.
And throughout those 15 years, you've always been looking for new concepts and trying to find out more about health.
Yeah.
And you've written a book which summarises a lot of your research into alternative health, Danielle.
Yeah, that's right.
So just tell us about that book, and tell me, will it be impacted by this research that we're going to discuss today?
Well, ironically, it's called Holistic Wellbeing, a Paradigm Shift, but it will have to go through another paradigm shift now.
Right. Okay. So this really important work that we're going to discuss today, why do you think that's managed to stay off your radar? The German new medicine, or the research of Dr. Hamer? It's
been like, yeah, I mean, when we come across it, we thought, well, that's exactly what we thought. How on earth haven't we come across this? I mean, the amount of reading we've done. We've also served as executive directors for the National Health Federation. So you think that we'd have come across it, you know?
I will actually say that when we present this research now, it's not necessarily going to be good for our business, selling supplements and the like, because it kind of doesn't really support that. So you could say it's not a great move for our business. So, I mean, you've also got that angle that maybe can people make money off this, you know, as a career.
All right.
Or business.
There's a lot of industries that would be under threat with all this knowledge coming out, really.
So I think it has been suppressed to a degree, we can say. Now, so how did you find out about Dr. Hamer's work?
It was late 2018, wasn't it?
Yeah.
And I'd received an email with some links to G&M. In response to a newsletter I sent where I mentioned that I had a high risk result, high risk of activity on a breast scan that I'd had, thermography breast scan. So I was just sent anonymously these links.
Right.
And so it was really the beginning of the year, beginning of 2019 now that we really sort of, I mean, it's pretty much taken over our lives.
Right. So later in 2019, you decided to go to Austria at your own expense, where there was a conference. So just tell us about the conference.
Okay, so it's really for practitioners or people interested in GNM.
So GNM stands for German New Medicine, and that is what the work of Dr. Hamer is generally referred to, or is it just by this group? Is that widely used term?
I think it's a widely used term.
Right.
It's a widely used term. I mean, originally he called it new medicine, but for various reasons it wasn't specific enough, so he then rephrased it German new medicine, because obviously he's from Germany, so that was that, and now specific enough then to sort of copyright or trademark or whatever. So yeah, so it's a generic term now, although there are other things which try to rip off some of his research and pass it off under completely different, you know, they're plagiarizing his research and calling it, they're, you know, rebranding it as something else. So obviously we're trying to be authentic and faithful to Dr. Hamer's work.
Right. So tell us about the conference. What kind of people were there? Were there any medical professionals there?
There's quite a lot, weren't there?
Yeah, I mean, we're talking like it's homeopathic doctor from India.
There's a few. Yeah.
There's a few, homeopathic doctors and sort of chiropractic doctors and the like. So kind of like with a toe in the alternative field rather than, let's call them mainstream doctors,
right?
Who this isn't going to sit with their knowledge.
Right.
Yeah, there was about over 70 people there, wasn't there? There was, I think it was 23 nations that were represented there. So.
Yeah, because this is a completely different way of thinking about disease and medicine. How does it differ from conventional medicine?
In every way conceivable, really. I think that conventional medicine is based on malfunction of the body and disease being a problem that you've got to fight, whereas German new medicine believes in the wisdom of the body and has trust in the body, and that everything is meaningful and purposeful. Mm-hmm. And obviously we can discuss.
Yeah, it's basically, I mean, conventional medicine is fear-based, really, when you think of it.
Mm-hmm.
And, you know, Dr. Hamer's findings are really empowering. So they do dissolve that fear.
Dr. Hamer passed away in 2017, and one of his students was a lady called Dr. Caroline Marcolin.
Yeah.
We're going to look at quite a lot of clips from Caroline's lectures. These go back quite a few years, and she was running the course that you attended, is that right?
Yeah.
Okay,
yeah.
so let's have a look at the first clip.
Well, medicine as we know it is based on the concept that diseases are malfunctions or failure of the organism. That diseases are caused by pathogenic microbes, by malignant cancer cells, defective genes, or a weak immune system. And these are just the most prevalent theories. Then there are also the so-called risk factors believed to increase the chance of developing a disease. Risk factors such as a family history of the disease, toxins in our food, in our environment, smoking, electromagnetic pollutants, geopathic radiation, diet, nutritional deficiency, hormones or stress, and the list goes on. Well, for the most part of my life, I believed all that. And I was also scared. I was scared of getting cancer and that I would have to go through this. Mastectomy, radiation, chemo. But one day, all of this completely changed. In 1999, I was in Austria at the time. I was invited to a lecture about German new medicine. First, I was hesitant because the media kept reporting that this Dr. Hamer was a charlatan, a quack, a psychopath who denied his patients the standard treatment, particularly chemo. Firmly anchored in the science of embryology, Dr. Hamer was able to explain the nature of diseases based on biological principles that apply to every human being and therefore to each patient's case. Founded on 5 biological laws, Dr. Hamer provided the scientific evidence that diseases are not, as assumed, errors of nature, but instead significant biological special programs of nature created to support an organism, humans, animals, plants, during unexpected distress, bringing to light that nature is not antagonistic and hostile, but that nature is caring, that nature is creative, and that the inherent force of nature is to protect its creation and to secure its survival.
Right, now I did plan to go over and interview Caroline. I had my flight booked and my hotel booked, but unforeseen circumstances, they got cancelled, so damn. Now, she refers there to errors and that diseases are not errors in nature. I've always believed that cancer or a tumour is caused when something goes wrong with the copying of cells, right? And that then that rogue group of cells, if you like, then copies itself, and it just continues on and on and on. But according to the German New Medicine, no, those tumour cells are different for a reason. And eons ago, back in evolution earlier, that tumour would have had some function to do with survival. And there's a natural process by which that tumour will be gotten rid of by the body. And we're going to spell it out in a lot of detail in this interview. Because this work is so different from accepted mainstream science, I think we've got to tread very slowly and be very specific about what we're saying.
Well, I think for us it was really challenging. We had to unlearn so much of what we thought we knew, and so that there can be a lot of resistance first.
Right.
There's definitely a huge step from the alternative that we were, I would say, with an alternative perspective. I mean, it would be an even bigger step from, let's call it mainstream medicine.
Yeah,
Right.
Even though it created a lot of resistance in us, and we could have just thought, no, this is just going against what we believe and what I've been trained in. It just felt like it was deeply resonating with us on a level that nothing else has. It almost felt like it was reawakening something that we knew deep inside. So we kind of pushed through and carried on.
Now, Dr. Hamer did try and get his work accepted and reviewed. Tell us what happened there. We're going to show a clip, but just...
Yeah, well, I mean, he did attempt through the proper channels to get it sort of peer-reviewed, if you like, and, you know, tested, put to the test. And all he ended up getting was persecuted and losing his doctor's licence. I think the clip explains.
Right. We are going to spell it out in a lot more detail, but I've got another clip from Caroline who explains here about Dr. Hamer's difficulties.
So why, we might ask, is Dr. Hamer's work not taught in medical schools? Why are not patients all over the world treated based on his discoveries? Why is this not common knowledge? Well, I'd like to give you a little bit of a background information. In 1981, Dr. Hamer submitted his findings, his discoveries, to the University of Tübingen as a postdoctoral thesis. But in spite of its legal obligation, the University of Tübingen and the medical faculty of Tübingen refuses to this day to evaluate Dr. Hamer's discoveries. So in 1986, Dr. Hamer took the medical faculty and the University of Tübingen to court. And in court, the judge asked the dean of the medical faculty why they don't test Dr. Hamer's discoveries. And this is what the dean said: "We don't want to know whether Hamer is right." Shortly after, Dr. Hamer was stripped of his medical license on the grounds that he did not revoke his discoveries. In other words, Dr. Hamer lost his medical license, although his discoveries have never been disproved. To this day, Dr. Hamer has been persecuted, and all his wonderful discoveries, this valuable knowledge, has been systematically suppressed by the authorities. Millions of lives could have been saved over the last 23 years, including lives of our loved ones. And this is how Dr. Hamer puts it: "We are fighting a crime committed on patients all over the world."
Now, Dr. Hamer was no fool. He had patents for medical equipment, and he was in charge of the cancer patients. So he was a mainstream doctor. Yeah. Now let's just come on to the actual crux, because I mentioned it there at the beginning, which is that throughout our lives we all go through unexpected trauma or shock where we can't sleep. And this German New Medicine states that that really is the trigger point for every disease, including cancer. He discovered this by looking at brain scans.
Yeah.
So Dr. Hamer ended up in prison twice, and when they took him to court, just tell us what happened there.
Well, when the prosecution tried to say that 500 people had died under his care by following his program, if you like, they actually were at the same time forced to admit that this was out of a group of 6,500 patients. So that represents, the 500 represents a small percentage. So actually the 6,000 out of the 6,500 is a 92%.
It's over 92, just about.
Success rate, basically, that did make a full recovery. And these, we're talking, the ones that referred to him, we're talking about, you know, terminal cancer patients.
Right.
So that's a fantastic, you know, with our knowledge of natural health cures, that, I mean, that is a fantastic statistic by anyone.
Right. So he went through a massive shock when his son died, and then he gets testicular cancer a few months later, and he thinks, is this connected? So he then started looking at his own cancer patients and started looking at their brain scans, and found that every one of them had this lesion in a specific part of the brain which is linked to the organ that they had the cancer in. And we're going to go through how the brain links to all the different parts of the body in a little while, but we'll just have a listen now to about how Dr. Hamer started doing the brain scans.
Based on the premise that all our bodily processes are controlled from our brain, Dr. Hamer obtained a brain scan of all his cancer patients. A brain scan, we have an example here, shows layers of the brain taken parallel to the base of the cranium. And Dr. Hamer compared the brain scan with his patients' medical records and their personal history. And he took particular attention to his patients' recent emotional trauma. And this is what Dr. Hamer found. Dr. Hamer found, and we're going to do this slowly, Dr. Hamer found that each cancer has its own area in the brain from where the cancer is controlled. And each cancer is linked to a very specific type of conflict shock that correlates psychologically and biologically to the same area in the brain that controls the cancer.
Right, so the diagram that Caroline had on the screen there is showing various parts of the brain, and we're going to go into it in more detail, and the types of conflict that trigger a lesion in that part of the brain. So we've got a nest worry conflict, indigestible morsel, death fright conflict. So can you just list some of these conflicts for us and explain a little bit about what these conflicts are?
Okay. So a nest worry, that would be like a deep concern over somebody or something that involves the nest. So the home, the family, like the pack kind of thing. Indigestible morsel, it can be something figurative or something physical. So in evolutionary terms, or in basic maybe animal terms, a morsel would be something like a bit of bone that is not being able to be digested. But because we're sort of more complex beings, if you like, and we have lots of layers, an indigestible morsel for us might actually be something figurative, like news or a situation that we can't digest.
Right.
So death fright is basically something that that happens, or a situation that makes you think that fear for your life. You know.
So we've got separation conflict, so that would be if you had your children taken off you, for example. We've got profound loss conflict, self-devaluation conflicts, male or female sexual conflicts, and abandonment conflicts. Now, these conflicts all depend on how you perceive the world in the first place, and what your morals are, what would naturally make you feel fearful in yourself. So you can change how your brain reacts to these conflicts by changing your own belief system. And that really is part of what the therapy would entail. But let's just have another listen to Caroline explain a bit more.
Well, the first biological law states that every disease originates from a biological conflict. A biological conflict differs from general stress, even from extreme stress, insofar as the distress, for example, the loss of a workplace, separation from a loved one, a cancer diagnosis, occurs entirely unexpected. From a biological point of view, unexpected implies that the situation could be detrimental for the one who was caught off guard. So in order to support the individual during such an unexpected and unforeseen crisis, and in order to facilitate a conflict resolution, a meaningful special biological program created exactly for that situation is instantly activated. And this biological program involves the psyche, the brain, and the organ. Based on the studies of tens of thousands of brain scans, Dr. Hamer discovered that a very specific type of conflict always impacts in the same area of the brain. On a brain scan, we see this impact as a sharp target ring configuration. Here we have an example. Dr. Hamer further found that it is exactly this brain relay from where the disease and also the disease symptoms are controlled.
So animals can get cancer and other diseases. So how would animals suffer conflict shock?
Yeah, it was interesting. There was some animal case studies presented at the conference, and they're actually more clear-cut because they haven't got such conditioning layers, or they're just not as complex as us. So,
and they haven't got fear of things as well.
Yeah, not unnatural fears, you know. So it's actually tends to be more clear-cut. But then obviously animals can't tell you they've got an earache or something like that. So there's only certain things you can observe with animals. Right. But it applies to animals as well as humans.
Right.
Yeah.
So being separated from their mother, or having their home taken away, or being kept in a cage maybe, or
certainly, I mean, territorial loss would be a strong one with animals.
Right.
Yeah.
So the conflict shock is referred to as a DHS, which was named after Dr. Hamer's son. So can you explain a bit more, what is a DHS?
So the DHS is that moment when you receive news or something happens and you're kind of like put into a state of shock. I found that the DHS that occurred before I had a previous serious condition.
Right.
Then the things that I experienced was, it was like as if everything went into a dream world and time stood still. And I felt like I was completely on my own, even though there were people around me. It was like very isolating. And I also felt like sort of tingles going through my body, as if this isn't really happening. So that's like quite a big one, really.
And unable to sleep is common, and cold hands apparently. Yeah,
that's when you move that, because as soon as you have the conflict shock, then you move into a phase known as the conflict active phase, and that's when there's hardly any symptoms, but there's like one or two markers like the cold hands, because your circulation slows down, and the sleeplessness because you're in an increased stress state that whole time.
Okay.
We humans share this biological conflict with all species. Like all living beings, we also suffer loss conflicts, separation conflicts, abandonment conflicts, death fright conflicts, existence conflicts, starvation conflicts, nest worry conflicts, territorial conflicts, sexual conflicts, attack conflicts, feeling stuck conflicts. Conflicts that threaten our survival, the safety of our domain, the bond with members of our group, or the group itself. While it is the psyche that registers instantly or instinctively such dangers. Of course, such a conflict is how we individually perceive such a conflict is highly subjective. It is determined by our social and cultural conditioning, by our knowledge, by our expectations, by our vulnerabilities, by our values and our beliefs. However, and this is the point, it is our biological assessment of the situation. It is our biological reading of the conflict that determines which biological program will be switched on.
Right, so a divorce can trigger conflict. Can you tell us about that?
It can in some instances, and it can't. So, for example, if a marriage had been breaking down for quite a while, even though it's really very, very stressful and very emotional and a horrendous time, it might not necessarily be less likely to sort of suffer a DHS than if somebody just came in out the blue and said, I want a divorce, then that's when there's more likely to be a DHS.
A Dear John letter, for example?
Yeah. It's something that's completely out of the blue.
Right. Mm-hmm. Once you've had this exceptionally large shock, a special program is triggered, which conventional science would refer to it as a disease, and they would only look at the organ. They wouldn't look at the psyche and the part of the brain that has triggered it. They're only looking at the organ level, right? Yeah. But this medicine encompasses the psyche and the particular part of the brain that controls that organ. So once that's triggered, it goes through a number of phases, which is common to all the different types of cancer and diseases, the phases. So
I mean, we are talking big and small, so a lot of things like sniffles or a skin rash or something will be a minor program that you may not even be aware of.
Right.
But obviously we're kind of focusing on the larger things because they're going to be things that you would be aware of and, you know, more interested in.
Okay, so Caroline here explains the phases that the program goes through after a conflict shock.
The moment we have this DHS, the moment the program starts, so during the conflict active phase, the entire organism is now engaged in facilitating a conflict resolution. So beginning with the DHS, the autonomic nervous system switches instantly into a prolonged state of sympathikotonia, causing sleeping difficulties. So typically, we wake up at 3 o'clock in the morning and start thinking about the conflict. But there is a good reason for that, because the extra waking hours and the total focus on the conflict allow us to find a resolution to the conflict as quickly as possible. And this is highly important, because the shorter the conflict active phase, the shorter will be the healing phase. We also call the conflict active phase the cold phase, because when we are stressed, our blood vessels are constricted, and as a result we have cold hands. So we have cold hands during the entire conflict active phase. So from now on you can start observing that. In other words, if you have cold hands for a longer period of time, or when you have such a conflict shock, your hands will immediately turn cold or become cold, which indicates now for you, I am in a biological program, which also means I should try to resolve this conflict as soon as possible in order to resolve it so the healing phase will be shorter.
Caroline had this chart in that lecture, so this is a more up-to-date version of that particular chart.
Yeah, so this shows the split between the old mesoderm and the new mesoderm.
Right.
There,
so it looks a little bit complicated if you've not seen it before, but just to explain. So we see here the DHS, that's when you actually get this really bad news and the conflict starts. And this wobbly line here represents the time that you are in shock, that you are in conflict shock. And that is the time when, for example, a tumour would be growing. Yeah.
If it was the old brain program,
yeah. If it was a different part of the brain, it would be a different type of cancer, or it might be functional loss, right? Yeah. So then you resolve that conflict at some point in time, and then a healing phase starts, which goes through 3 separate sections.
As soon as the conflict is resolved, the whole organism is now mobilized to restore the organ to its original function. First, the autonomic system instantly switches into a state of lasting vagotonia, forcing the organism to rest while healing runs its course. And now we're seeing action. All additional cells that were generated during the conflict active phase are now broken down and removed. Cell loss that occurred during the conflict active phase is now restored, refilled, and replenished with new cells. And now we are seeing symptoms we are all familiar with. For example, fatigue, because the whole organism is now in a state of lasting vagotonia, so we are very tired. Fever and inflammation, because of the increased blood flow to the healing tissue. Swelling. Healing always occurs in a fluid environment, so where there will be swelling, swelling causes pain. Then there is discharge, because the remnants of this decomposing and reconstructing process are now going to be eliminated. They're going to be eliminated through the urine, through the stool, through the skin, through the sputum in the case of lung cancer, through the vagina in the case of uterus cancer. Okay. There will also be night sweats, but night sweats only occur when tubercular bacteria are involved, because healing also involves the participation of bacteria and of fungi, which takes us to the fourth biological law and the beneficial role of microbes. So Dr. Hamer found and confirms that fungi and mycobacteria, which are the oldest microbes that populated the oldest tissue that is controlled from the oldest part of the brain, that these fungi and mycobacteria now remove and decompose the cells that are no longer required. So infections like candida infections or any bacterial infection only occurs during the healing phase. Tubercular bacteria and fungi also remove cancers. They remove lung tumors, liver tumors, breast gland tumors, pancreas tumors, liver tumors, prostate tumors, and so forth. All tumors that are controlled from the old brain. If a person doesn't carry the necessary microbes, let's say because of an overuse of antibiotics, the tumor stays in place and encapsulates.
So the German new medicine is based a lot on embryology, which is the study of what happens as a fetus goes through its various stages. So just tell us about the different parts of the brain and what are referred to as germ layers.
Okay, so there's the old brain. This is from the GNM perspective now, and I'm going to go into all the parts of the brain, but this is the bits that are relevant to German new medicine. So the old brain is the brain stem and the cerebellum, and then the new brain is the cerebral medulla, which is part of the white matter, and it's hard to find that anything about the cerebral medulla actually. And there's also the cerebral cortex, so those two parts make up what is termed as the new brain. The three germ layers in embryology are the endoderm, which was formed first, and the mesoderm, which was formed second, and then the ectoderm. So what Dr. Hamer found was the tissues and the organs that were a part of the mesoderm germ layer. He found that some of them were controlled by the cerebellum and some were controlled by the cerebral medulla. So he split that into the old mesoderm and the new mesoderm. Mm-hmm. So there's actually 4 germ layers from a GNM perspective.
Right. And if you look in those sections of the brain within each germ layer, your organ is controlled or regulated, let's say, by a particular part of that germ layer.
Yeah.
So there's a link, let's say, between your liver and a part of one of the germ layers in your brain, and you can map out all of your organs, all of your bones, all of your skin, everything to a particular area of the brain, and it's always in one or other of the germ layers.
Yeah. And some organs and tissues are split, so as you'll have like the main body of it is one part of the germ layer, and then later in development another layer came into it. So some organs like the pancreas and the liver and the stomach, they've got like multiple germ layers to them.
Right.
Yeah.
There's things like duct linings which come in later, so there'll be a younger germ layer.
Right.
Yeah.
It's a little bit like a power station, where you have a control room in a power station, right? And you've got your turbine, you've got your boiler, you've got the generator, you've got your water systems, all different systems, but they're all controlled by the control room. And in that control room, you will find a little slider that controls the boiler. You will find something that, so that's what's happening in the brain. So the brain is the control mechanism for all of those auxiliaries that are in the body, all of those different parts of the body. But the control room is made up of these different germ layers, which go back billions of years or millions of years, right? And the key to it all is that depending on which germ layer the organ is controlled by will determine the type of cancer that you,
the type of program,
or the type, whether it generates new tissue, i.e. a tumour, or whether it recedes the tissue, like bone
and then
cancer.
builds it back up.
Right. So we'll explain that in a bit more detail. It is very detailed. We'll have another listen to Carolina.
This is a blastocyst. A blastocyst contains a cluster of cells from which the embryo develops. On the 13th day after conception, in other words 13 days after the fertilization of the egg, the blastocyst divides into 3 embryonic germ layers, which is the endoderm, the mesoderm, and the ectoderm. And it is from these 3 germ layers from which all our organs and tissues developed. In fact, we have to point out and realize that when the fetus develops in the womb, or the fetus develops, that the fetus passes all the evolutionary stages from a single-celled organism to a complete human being. And we're going to look at this now in details. Okay. The endoderm develops all the organs of the intestinal canal or the alimentary canal from the mouth to the rectum. The endoderm also develops the liver, the pancreas, the lungs, the prostate, and the uterus. From an evolutionary point of view, the endoderm is the oldest germ layer. And that is why all organs and tissues that derive from the endoderm are controlled from the oldest part of the brain. And all these tissues that derive from the endoderm and are controlled from the oldest part of the brain are the same cell type. They are all so-called adenocells. And in full accordance with evolutionary logic, all organs that derive from the oldest germ layer relate or are linked to the oldest biological conflicts. Conflicts that relate to breathing, procreation, and food, literally or figuratively. And what we have learned is that all organs that are controlled from the brainstem, they generate exclusively cell augmentation or a tumor growth during the conflict active phase. And during the healing phase, the tumor is broken down with the help of mycobacteria and fungi that are the oldest microbes that populated the oldest tissue that is controlled from the oldest part of the brain and that derives from the oldest germ layer. See, we have a system. The mesoderm develops our underskin, the corium skin, the skin underneath the epidermis. It also develops the breast glands, the pleura, the ovaries, the testicles, the spleen, bones, muscles, and other tissue. And all tissues and organs that originate from the mesoderm are controlled from either the cerebrum or from the cerebral medulla, which is the interior part of the cerebrum.
So she said that there's 3 germ layers, but what you explained before is that one of those germ layers, they split into 2.
Yeah.
Yeah.
Yeah, in a sense.
Right, so what were they called again?
So it's the old mesoderm and the new mesoderm.
Right,
yeah.
okay.
At a later time during evolution, we developed a second skin, which is the epidermis, which covers entirely the underskin. And the skin, the epidermis, derives from the ectoderm. The skin consists of squamous epithelial tissue. And over the course of evolution, the squamous epithelial tissue also migrated into the mouth and into the rectum. It lined all the canals and ducts in our system. It lined the pancreas ducts and the bile ducts. It lined the stomach and so forth. And being the youngest tissue type that derives from the youngest germ layer, all these organs and tissues that derive from the ectoderm are exclusively controlled from the youngest part of the brain, which is the cerebral cortex. And accordingly, these tissues relate to more advanced biological conflicts like separation conflicts, territorial conflicts, identity conflicts, and so forth. And all these tissues, as we have learned, they generate a meaningful tissue loss during the conflict active phase, which is refilled and replenished during the healing phase. So Dr. Hamer's discoveries, as we so beautifully see, they provide us with a complete biological system that explains not only the cause, but also the natural healing of diseases in the context of how our organism developed over time. And the beautiful thing is that this complete biological system does not only apply to us humans. All species, whether fish, reptile, mammal, or humans, respond to the same type of biological conflict with the same biological program. In other words, every species responds to a death-fright conflict with the proliferation of lung cells. Every mammal responds, or female mammal, responds to a nest worry conflict with the proliferation of breast gland cells.
Cell proliferation, we've got cell loss or functional loss. These are characteristics of diseases.
Yeah.
And they are all associated with different parts of the brain. So what we're saying is that backwards in time in evolution, the proliferation of those cells had a function which has since been lost, but it's like a hangover from evolution, if you like, as is the cell loss. There would have been a reason for that, but it's the program still triggers, and the body can still repair either type, and will if it's left to its own devices.
Yeah.
Right.
Yeah. Unless there's complications, which I think we're going to touch on as well.
Right.
Isn't it?
In this next clip, Caroline explains cell proliferation.
During the conflict active phase, the entire organism is mobilized in order to facilitate a conflict resolution. Okay? So if more tissue is required to facilitate a conflict resolution, the conflict-related organ responds to the conflict with cell augmentation or cell proliferation. So here we find during the conflict active phase tumors, for example, in the colon, in the lungs, in the liver, in the pancreas, in the breast glands, in the prostate, in the uterus, but also an overactive thyroid or enlarged tonsils. And all these conditions are linked to very specific biological conflicts that Dr. Hamer has identified.
Can you just explain the three elements of the healing phase? So, for example, by the time it gets to here, you've got a tumor of a certain size.
So, okay, so in an old brain program.
Yeah, an old brain program.
Say, for example, a colon cancer.
Colon cancer, yeah. So you've been in conflict for, let's say, a month. You've resolved it. You've got quite a big tumour here, right? And then it will heal itself. Yeah. So just explain these phases of healing then. So
first of all, you go into the first phase of healing, which in the old brain tissues there will be cell removal. So, and this is why the cells are different from the cells, the regular cells that are there, because the
program has to remove those cells. And
and they have to be identifiable. Yeah. So there's fungus and bacteria that come in to break down that tumour. Mm-hmm. And once that work is complete, then we'll go back into the stress phase in order that we can push out the waste. So it creates a stress on the body to push the waste out. Right. That's called the epileptoid crisis. And then after that, then you'll just get like scarring and repair work.
And that's when you might
get back to normal.
You might get blood being passed.
Yeah. So in the first phase, you'll get. I like to refer to think about a boil. Mm-hmm. So in the first phase, you're going to have inflammation. It's going to be red and sore. You're going to have a lot of activity with bacteria, maybe fungus as well. Up. It's going to be swollen, with the inflammation. And then the epileptoid crisis is when it bursts, and then it starts sort of. So it's still sore and things like this, but it's kind of clearing up, and getting back to normal, and the tissue then is being repaired.
Right. So, for example, you might pass blood, or you might have blood in your stool, or you might wee a lot in that final phase because your body's
getting rid of the inflammation and things. Yeah.
Right, and this is the incredible thing for me, that the tissue in a cancer tumour is different because the body has to know which cells to take away. Yeah. It's not a mistake. Mm. Yeah. It's like that for a reason, because the body knows, or the program knows, once the conflict's over, I'm going to get rid of this. And it's a totally natural process, according to the GNM. Yeah. All right.
Well, the reverse principle applies to all organs and tissues that are controlled from the cerebrum. Okay, so I've reviewed this. All old brain controlled tissue generate during the conflict active phase cell augmentation. Old brain is the brainstem and the cerebellum, so the oldest part of the brain. The opposite principle applies to all organs and tissues that are controlled from the new brain, or the so-called cerebrum. So if less tissue is required in order to facilitate a conflict resolution, the conflict-related organ responds with tissue loss, as we see, for example, in osteoporosis, in necrosis of the ovaries or the testicles. And again, all these conditions are linked to very specific conflict Dr. Hamer has identified. But we also have a third category, because certain cerebrum-controlled tissues, for example the muscles as already mentioned, but also the tissue of the inner ear, but also the so-called islet cells of the pancreas, they respond to the related conflict not with cell augmentation, so with tissue proliferation, cell proliferation, or tissue loss, but with functional loss or functional impairment, as we have already seen with the example of muscle paralysis. Here we also find hearing loss. Here we find also diabetes.
The GNM have produced a chart which consists of the 3 germ layers and all of the organs that are connected to those germ layers and the types of conflict that will trigger the program. Yeah. Okay, so I'm going to put some diagrams up on the screen of the various brain parts and the organs that are controlled from these different brain parts. So we're looking first at the brain stem. All right. So which germ layer is this?
This would be the oldest germ layer, so this would be the endoderm.
The endoderm. Yeah. Right, so we can see there where it's situated in the brain with the yellow here. Yeah. And on the diagram we can see these circles represent different zones in the brainstem that are controlling or regulating all of these different parts of the body. Yeah.
Yeah. So on a scan of the brainstem layer at that level of the brain, obviously they are the areas that will show up with the hammer focus, the concentric circles, at the same time as the organ is experiencing the going through the program.
Right. So, for example, somebody gets liver cancer. We've got liver here.
Yeah.
So there would be concentric circles would appear at that part in the brainstem here, where it says liver, at the same time a tumour was growing.
Yeah, it would, yeah, because we're in the old brain program, so it's cell proliferation in the first phase.
Right.
Yeah.
So this research has proven beyond any doubt that when you get, let's say, liver cancer, you will have a lesion in the brain at that specific place, and it will always be there, right? Now, current medicine only looks at the organ. They're not doing brain scans on cancer patients, are they?
No.
Right. But Dr. Hamer found that there would be a lesion in that very specific part of the brain which regulates the liver while there's a tumour growing, yeah? But they've taken it even further because they're saying that the brain is controlled or part of the psyche. In other words, how we perceive the world. And that's where it comes in, if you like. That's what triggers it. It's an experience that we have in our world that links to that part of the brain and the liver simultaneously. So it's...
It's part of the first law. What he said was the psyche, the organ and the brain are not separated. They are one thing.
Yeah.
So everything happens to them simultaneously.
Right.
So shall I just say as well that obviously people analysing brain scans, that area of medicine, are concerned with the brain, so they're not looking at it in relation to parts of the body. So,
or the psyche.
Or the psyche. So it's its own, you know, brains. People who analyse brain scans are looking at the brain with problems in the brain, basically. So, and obviously Dr. Hamer has brought this to attention, and they're basically generally dismissed as artifacts, even though Siemens, who make some of the brain scan equipment, have said no, they're not artifacts, because they're going to be observed at sort of like different layers. You know what I mean? It's reproducible. It's not.
But he's taken brain scans from tens of thousands of patients and found these so-called artifacts.
Yeah.
Always in the place that links to the organ that they've had cancer in, or other diseases, which we'll come on to.
And if it was an artefact, it would be on different layers of the brain, not just the one, wouldn't it? If it was a fault with the camera or whatever, you know?
Yeah.
It would appear on every single scan.
So we see how detailed this diagram of the brainstem is. We've got all of these different parts of the body. Left kidney collecting tubules. So it's not just the kidney, it's actually the tubules. It's
yeah, this is where I said about the organ being split kind of between the layers,
Right. So an organ might be split between different brain layers. Interesting, right? So we've got small intestine, pancreas, liver, stomach, esophagus, left and right mouth, pharynx, left lung. So he's splitting the actual sides. So he can actually, by looking at a brain scan, he can tell you which lung the cancer is in.
Yeah.
Right. So in theory, you'd be able to give him a brain scan, right, someone with a full brain scan, and he'd probably be able to tell you which type of cancer that patient has got.
Yeah.
But a person who's just looking at brains isn't interested in any of that. Is that
exactly
right? So so let's just stick with this brainstem for the moment then, and list some of the conflicts that he says trigger this biological program. So mouth and pharynx, right? He's got a morsel conflict.
Yeah, so they're all going to be morsel conflicts here, because in the oldest part of the brainstem, we're looking at very instinctive and primal sort of conflicts. So it's something to do with taking in and getting rid of.
Right.
If you know what I mean.
Yeah, I understand. Yeah. It's less sophisticated.
Yeah.
So choroid, iris, conflict related to visual morsel, middle ear, conflict related to a sound morsel, lung, a death-right conflict, and it goes on and on and on. So he's identified all of these very, very specific types of diseases and cancer: pancreas gland, indigestible morsel conflict, colon, indigestible morsel conflict, which is what my father had. Right. Okay, so let's come on to this other layer, the cerebellum. All right, so that's, we've got the diagram here of the brain, we show where it is. And again, we've got the breasts coming in, right breast glands, left breast glands, words I can't pronounce.
Pleura and peritoneum. We've got the corium skin and the pericardium. These are all like our protection. So the conflict theme, I guess, for this this brain area is an attack conflict. They're all types of attacks that would that we need to protect ourselves against.
Right. And Lloyd, do you think that medical science agrees that all of these different parts of the brain are linked to the different organs and the different parts of the body? Or do you think it...
Not that I've come across. I don't think they've made the association.
How did Dr. Hamer find out that the various parts of the brain are linked to that organ? Is that through the embryology? Or was it through looking at cancer patients' brain scans?
Well, he defined his laws in a certain order, and I think the brain scans was early on, and then the embryology was added later. It's like the third law.
Right.
Yeah, he sort of realised that. Yeah.
So the analyzer, he came up with the first two biological laws, so the brain scans and correlating them to the parts of the body was his early observation, and then as he developed it, he realised it corresponded to the germ layers and the embryology side of it. The embryology is that the brain stem develops first, and that part, so it's the alimentary canal, is developed at the same time as that brain. Yeah, so this is observed, and he's obviously built on that observed science.
Right. So the various germ layers, as a fetus is developing, this sort of one starts, then another, this sort of, and the organs associated with them are growing at the same time.
That's exactly it, yeah.
Right. So the cerebellum, we've got organs include the corium skin, the breast glands, pericardium, and the biological conflicts are attack conflict, nest worry conflict, attack against the heart, other words I can't pronounce, eyelid glands, eye-related conflict. Okay, let's move on to this other part of the brain, the cerebral medulla, all right?
Yeah.
So, again, it's very, very detailed, and we see all of the different parts of the body that are presumably regulated by all of these parts of the cerebral medulla. So we've got the foot, the knee, the femur, the pelvis. So we're into bones now with this one, aren't we?
Yeah.
And the muscles as well.
Bones and muscles. Okay, and these are these bones and joints, a self-devaluation conflict. So you could, if something devalues yourself, you could get bone cancer. Right, so people who, if anyone who knows anyone who's had bone cancer, you would look at their past, look to see if there's been something massive in their life that's caused a huge self-devaluation, and that is what will have triggered it.
It would be a severe self-devaluation for the bones.
For bone cancer, right. So what Dr. Hamer has discovered in all of his cancer patients, thousands and thousands of them, every one of them had some sort of conflict shock which triggered it, and he could link that part of the brain to that organ, and then find out what they'd gone through which caused it. We've got muscles, spleen, fat tissue, heart valves. We'll come on to the heart. So another part of the brain now, the cerebral cortex. So now looking at the newer brain layers, which is cell loss and functional loss.
Yeah.
Right. We've now got other words that I can't pronounce. Coronary arteries. So we're into the heart now. The left bladder, the renal pelvis, the right retina, the left retina on different sides. And again, lists of very detailed different types of conflict that can cause problems, quote-unquote problems, in those areas. Not getting enough air conflict, not wanting to swallow a morsel conflict, wanting to be seen, not wanting to be seen, visual separation conflict, a bite conflict, separation conflict, sexual conflict, powerless conflict or frontal fear conflict, scare fright conflicts, and it goes on. A hearing conflict, a balance conflict, fear that cannot be shaken off, and fear of a predator. So these all affect these various different parts of the brain stroke part of the body. Yeah. It's incredibly detailed, and it's amazing that assuming it's all true, that it's not part of regular medicine. We've got temporal lobe related organ conflicts. So we see here in green the temporal lobe. Yeah. Just want to mention a few of those, Danielle.
Okay. So we've got the larynx musculature, which is a scare-fright conflict. That would be on the female side of the brain. So a male, in the same area of the male side, you've got a bronchial musculature, which is a territorial fear. So I'll just mention about the female and the male. So a male, if he's got normal hormone status, would usually only suffer male conflicts. Mm-hmm. He can't suffer the female conflicts. Mm-hmm. So when he gets of a certain age and his testosterone goes down, so he's not of a normal hormone status, then he will move into the female side of the brain and start experiencing female conflicts. Mm-hmm. And the same with a woman. A woman would only suffer the female conflicts unless she's on birth control pill that could alter the hormone status, or had a hysterectomy, or is post-menopause, then she would be not of normal hormone status, so she would move into the male side. So what we're looking at is the male is all like territorial, is what you would expect, you know, for males to sort of suffer. And then the females on this side, then you've got like scare fright, sexual conflict, identity conflict, and you've got a market conflict on the female side too.
It's interesting that the sexual conflicts in men result in prostate cancer, and in women it's cervical cancer, I think. Is that right?
Yeah.
And obviously organs related to sex. Mm. And with breast cancer, it's a nest conflict, is it? So in other words, to do with the home or your child.
Yeah, because the breasts are for nurturing, aren't they?
Yeah.
First and foremost.
Right, yeah. And think of a few other things, but we'll not go into that. Right. Okay, let's have another
suffice to say, it's incredibly complex, that layer.
Yeah, this layer is really complex, so it's difficult to go into concisely, kind of thing.
So Caroline is going to talk about breast cancer in this next clip.
If a female suffers a nest worry conflict over the well-being of her child, the mesodermal breast gland cells controlled from the cerebellum instantly start to proliferate. The biological purpose of the cell proliferation is to provide more milk to the child in order to increase its chance of survival. And it is these additional breast gland cells that form a breast gland tumor. And even if a woman is not breastfeeding, this biological program is still activated, because in biological terms, the female breast is synonymous for caring and for nurturing. So every female, whether mammal or human, is born with this biological response. It is a biological response that is encoded in the cells of her breast glands, in the brain cells that control the breast gland, and in the female psyche.
So if one is in a conflict and you've got a tumour growing inside you, right, due to that conflict, if that problem doesn't get fixed in your own psyche, it could grow to the tumour could grow to a size where it's going to kill you. Is that
depending on the organ? If it's a critical organ, obviously, but it has the potential to impede other organs as well. If it's
what you usually find though is there's some measures to reduce the size of the tumour or surgery or whatever. So, and this is when you might have a relapse then. If it's not healed, then it can come back on the psyche level then.
Yeah. So let's say you've got a tumour. Normally, if you don't know about it and you get past this conflict, it will just carry itself off. You might pass a bit of blood or what have you, but you wouldn't even know that you'd had cancer, yeah?
Yeah, exactly.
Or had a tumour.
Yeah.
But on some occasions what will happen is you'll see the blood in your stool or whatever it might be, so you go to the doctor and then this tumour will be then picked up, right? So then what happens? You're diagnosed.
Yes.
That gives you another conflict shock, which might give you cancer elsewhere in your body, but we'll come on to that, right? Yeah. But then they start their mainstream medicine.
Right.
Yeah, so just tell us about the 3 types of medicine that they will offer you on the NHS.
Okay, well, the standard treatment is cut, poison or burn. So that is to have it cut away, surgery, or to chemotherapy, or radiotherapy, so that's targeted and basically burning the cells.
So they can cut you, they can burn you, or they can give you chemo, right, in order to deal with this tumour. Now, bearing in mind that German New Medicine explains that your body will naturally get rid of that tumour if you overcome this conflict, right? So it might not be advisable to go down one of those 3 routes. In fact, it could be detrimental, according to German New Medicine. Yeah.
But certainly those are, for the most part, going to be totally contra to the GNM. There's a no phase where you're going to be assisting the process. Exceptions might be if a conflict hasn't been resolved and the tumour continues to grow, and like I say, is causing problems, then surgery may be the only option. But for the
But the other 2, you would say that they would hinder the body's natural systems for dealing with the program.
Well, they're doing a lot of. They're going to do a lot of, putting a tremendous amount of stress on the body in one form or another, which then itself could create further conflicts, or it's not going to be in harmony with the process. I mean, obviously we've got to be careful what we say, but certainly having something burnt away, the program in the body, if the conflict is resolved, is to naturally take that away using bacteria and fungi, and it's not going to be allowed to do it. So you're working against the program.
Right. So you mentioned bacteria and fungi there. So microbes, which are used to remove tissue. Just tell us about that, Lloyd, and tell us about what mainstream medicine says about the microbes and the TB. Okay,
well, Dr. Hamer says that microbes are essential, and they do the work of breaking down a tumour. So we're talking older germ layers now where there's been tumour growth.
So Dr. Hamer found and confirms that fungi and mycobacteria, which are the oldest microbes that populated the oldest tissue that is controlled from the oldest part of the brain, that these fungi and mycobacteria now remove and decompose the cells that are no longer required. So infections like Candida infection or any bacterial infection only occurs during the healing phase. Tubercular bacteria and fungi also remove cancers. They remove lung tumors, liver tumors, breast gland tumors, pancreas tumors, liver tumors, prostate tumors, and so forth. All tumors that are controlled from the old brain.
Am I right in thinking that mainstream science says that tuberculosis is contagious? Yeah. But according to German New Medicine, it's not contagious. It's something which the body uses to remove tumours.
It's literally, you're going to have high levels of tubercular bacteria in the process of removing tumours. That's what they...
In the old brain programs.
In the old brain programs,
Right. And the same applies with fungi?
Yeah, so Candida, for example,
right.
As a nutritional therapist, I went for years thinking that was an enemy, and it's actually,
right.
working for us.
We've explained what happens with organs. They can have a tumour or they can have tissue loss, right? And that organ is associated with a particular part of the brain. So you mentioned that there's a lesion in the brain. So does that repair itself? What actually happens in the brain when the organ is repairing itself?
Okay, so on brain level, I mean, the healing happens simultaneously on the organ and the brain.
Right.
So at brain level, we get the lesion and the conflict, the DHS, and then the conflict active phase. When we go into healing, that lesion will be surrounded by inflammation in order to protect it and to facilitate healing, because the body heals better in a fluid environment. So there's another sort of shocker, is inflammation is actually helpful to us.
Right.
Whereas we class it as something that's bad. At the epileptoid crisis then, when there's that additional stress, the inflammation is pushed out.
Right.
And then glia cells will come and repair the lesion.
Right. And if you're unfortunate enough to have a brain scan, or maybe a headache, let's say, and get a scan, you could be diagnosed with a brain tumour.
Glioma, yeah.
A glioma.
Yeah.
Right. And then they'll start firing radio waves at that, or whatever. I don't know what the treatment is for a brain tumour. Is it chemo?
I think it's radiotherapy.
Radiotherapy. Well, whatever.
I think it depends on the part of the brain.
Right. Right. So if that's the case, then would a let's say a brain doctor not realise that all of these patients with a tumour in that particular part of the brain have all got kidney cancer, or they've all got lung cancer?
Well, they're only looking at the brain, aren't they? So,
right.
and you know, you go to a sort of organ doctor, they're only looking at the organs.
Right. So they might have a cancer in one of their organs, which is repairing unbeknown to anyone else, right?
Yeah.
And they've got a lesion in the brain, which is diagnosed as something completely separate. They're not considering the part of the brain with the organ as two things functioning together.
And if they are both found, they say, oh, it's metastasized.
Right, we'll come on to that, right. Okay, so Lloyd, can you tell me what is the method of communication between the organ and the part of the brain? Is it hormones, or is it central nervous system? How or is it both, or?
Well, it hasn't been clearly defined, but certainly hormones play a role.
I mean, what he said was about the psyche, brain,
this is
and
Dr.
organ.
Hamer you're talking about?
Yeah, Dr. Hamer. What he said was that the psyche, the brain, and the organ, everything happens simultaneously.
Right.
So,
well,
if something happens in the brain and then it sends a signal, that's how we understand it. But maybe that's again something we have to unlearn.
Yeah, there could be communication that we're completely not aware of using some other means, but it's due to embryology. They know that parts of the brain are linked to certain organs. We can say that at the least, yeah?
Right, yeah.
All right, so when people get a tumour, it will encapsulate sometimes. Just tell us what encapsulation is.
Okay, well, so if we're talking about a tumour which has grown in the active phase, then obviously once that conflict has been resolved and then it's set about to be taken away with bacteria and fungi, then if there's insufficient bacteria and fungi to do it, because of antibiotics, etc., as Caroline mentioned, then it will get encapsulated and it can just stay like that forever and a day.
Yeah, it's quite harmless. You know, you can live with encapsulated tumours. Yeah.
So that's a perfectly natural process of the body, that it will either get rid of the tumour, or it could encapsulate it.
Yeah, they separate it.
And that's what they would refer to as something that's benign, is that right?
Possibly.
Because it's not going to be growing or shrinking, it should just stay as it is. So yeah, that would be classed as benign.
So the problem with this is, you know, you can have an encapsulated tumour and know nothing about it, and then, you know, when you're sort of like so many years down the line then, and you're of a certain age, and then get asked for these mammograms all the time, and then it's picked up and treated as if it's a new cancer, you know?
Yeah.
Or a new find, you know?
The sort of definition of benign is basically not growing or below a certain rate, but you're still going to have the initial shock of, we found a lump, and you might have to go back after a period of time to have another scan and have it remeasured to see if it's growing, to see if it's classed as benign or malignant if it's growing above a certain rate.
Right.
So obviously, even they may say, oh, it's benign, you still have had a shock because they found a tumour.
Or you might, you know, it's not like a guaranteed thing, but it depends how people perceive it.
But with German new medicine, if you've got a malignant tumour, it's nothing to worry about. As long as you can get over whatever the conflict is that started it, the body will get rid of it naturally.
Yeah, well, the thing is, from a GNM perspective, the benign malignant thing just depends on where you are in the program. It's the same tumour.
Yeah.
It just depends on if it's in the
running.
growth and which program's running. So it depends if it's in a growth phase or if, in a removal phase.
So even a tumour which is being broken down is going to be surrounded by a pocket of fluid to assist with the healing process. So the actual lump, although it may not be hard, would be inflamed, let's say. So it might appear larger.
And in one of Caroline's lectures, she compares it to, let's say, having a really bad wound on your knee.
Yeah.
And you know it's going to get better, you know it's going to heal, but it will swell up, and pus will come out of it, and it won't look nice, but eventually it's going to get better.
Yeah.
And it's exactly the same with the tumour.
It's the same program. The same with the boil that I said about. You know,
Right.
it's exactly the same. It all follows the compass.
All right. So let's now mention the immune system. So can you explain? Because I don't think GNM call it an immune system. They call it a support system. So can you explain that?
Well, the idea of having an immune system is that it's a defence system. So this is based on the idea that the microbes, such as fungi and bacteria, are actually fighting us. You know, that we need to protect ourselves against them. And also cancer cells and things like this, that they're all out to get us, you know.
Right.
So when we go from a GNM perspective, which proves that that isn't so, then there is no need for a defence system. Why would we have a defence system? So what Dr. Hamer found was all the components of the immune system actually were assisting healing rather than defending us.
Well, what is the immune system? According to conventional medicine, the immune system is a defense system against microbes and cancer cells. Thus, according to the theory, a weak immune system increases the risk of infectious diseases, we hear this all the time, and of developing cancer. Well, medical science views the immune system, or views, I should say, our body as a battlefield where white blood cells are ready to attack the enemy. In fact, daffodils are now, symbolically of course, also turned into weapons in order to fight cancer. But my friends, if we learn to understand that cancer is a meaningful process, that microbes are our loyal helpers, then the entire construct of an immune system falls apart. There is no immune system. The immune system does not exist. What exists, however, is a perfect biological system created to support us while we are healing. And that includes the supportive function of white blood cells, of antibodies, and many other biochemical processes. You see, Dr. Hamer puts everything on its head. Because if we learn that diseases are meaningful, that these are programs that have been practiced over millions of years, we realize that most theories of conventional medicine are based on assumptions that have actually never been substantiated.
So that's why he coined it as a support system, because it's supporting our natural process.
Right, so and this doesn't just apply to cancer, it applies to, so in other words, other diseases which can be triggered by a conflict shock are heart conditions, skin disorders, diabetes, arthritis, mood disorders, mental imbalances. We'll come on to some of the other diseases a little bit later. Now, obviously, there's a lot of questions which are raised by this, and we've mentioned one, which is the immune system. What about chronic disease? If diseases are not to be feared, how do they become chronic?
So basically, a chronic disease is when a healing phase of the program fails to complete for some reason, and it's usually because of things such as something that's happening at the time that's non-supportive to the program. So for example, if you've got a lot of stress and the body relies on a non-stress phase for the healing, then it can slow down or stop healing.
Why does healing often take so long? Why do diseases become chronic? Well, the answer is because we keep scratching that wound in our psyche, or we allow others to reopen a wound that is trying to heal. And we also have to be aware that most pharmaceutical drugs interrupt the healing phase. And the most brutal kind of interruption is chemo treatment.
Some medications are stimulating, so they can stop healing and put you back into even conflict active phase, where there are no symptoms then, and you think the medication has got you better, but it's just keeping you in the loop, if you like.
So is that what you would refer to as a relapse?
This is what we'd refer to as a hang-in healing. It's called a hang-in healing, so it's a healing that's failing to complete.
Okay. Relapse would be something that happens later.
Yes, yeah.
Right.
However, using the same word, there's also conflict relapse. So, for example, if the conflict keeps happening before you've completed the phase, then it can put you back into conflict active, and then you go into healing, and then the conflict relapses again. You know, either that can be either physically or mentally. So you can keep thinking about it and worrying about it, and, you know, taking yourself out of that non-stress phase, or sometimes add in another conflict. So, say for example, we have some sort of diagnosis and we're dealing with that, and then we start self-devaluing. So we can add then another layer to it, if you like.
Right.
So then we sort of run into programs. So this can sort of prevent healing as well.
All right. So just to recap, when you get the conflict shock, you go into this phase and there's not really any gruesome symptoms.
No. Right.
Maybe cold hands or
just
unable to sleep.
Yeah.
Yeah. You get the symptoms after your body started to deal with that tumour or whatever it might be.
Yeah.
Yeah. So you just wanted to make a point about that, about the healing phase.
Yeah, so when we're in healing is when we get the symptoms. That's usually when we go for diagnosis and treatment.
So if you get a diagnosis shock, so you've already got this in the healing phase, you're going to set off something else in the active phase. This is when you can have multiple things, programs running at different phases, which kind of will interfere with each other maybe.
Right, okay. You just wanted to point out something about chemotherapy in relation to this diagram.
Yeah, so chemotherapy is what's classed as a sympathicotonic agent. In GNM terms, it's stimulating to the body. It takes you out of the vagatonic stage, which is needed for healing. So if someone has chemo and they're in the healing phase, it puts them back into conflict active phase, which explains that in some programs that the body is running that have cell proliferation in the conflict active phase, it explains why chemo sometimes makes tumours grow faster.
Right.
Or more of them.
Right.
So relapses can occur, particularly if there's no healing on the psyche level, as we have said many times. But if it's like the healing has not completely taken place, then so that can happen. But there can also be a track, which in GNM terms, a track is like a trigger for that program. So it's a subconscious association with something that you could be perceiving at the time that you have the DHS. So when you have a DHS, your brain goes into this like highly receptive mode and it's looking for warning signs. So as in the future, if if they see one of these warning signs again, they'll think, oh, I know what to do. I'm going to go into this program. It's kind of like that sort of thing.
Right. Let's mention toxins, because a lot of people will believe that cancer is caused by toxins or disease is caused by toxins. For example, smoking causes cancer. So just tell us about, do toxins increase the risk of certain diseases?
According to GNM, no.
Based on what we have learned, based on that cancer and diseases are not something out to kill us, right? If nature were designed to produce cancer cells in our body to kill the organism, we would not be sitting here, right? So let's look from that new understanding, based on this new paradigm, to the question if toxins can in fact cause cancer. While the theory that toxins cause cancer is a widespread belief, and it also causes a lot of fear, adding to the fear that is already associated with cancer. While this does not say, or we are not suggesting, that toxins are harmless. Toxins in our food, in our environment, environmental toxins, smoking, etc., of course deplete the body, deplete our organism of energy, which means that we are more susceptible to suffer a conflict shock, and also a body depleted of energy has a much more difficult time in the healing phase. There are also so-called neurotoxins that are in dental fillings and in vaccines, and absolutely this neurotoxin can cause severe nerve damage and neurological disorders. But, my friends, and this is the point, toxins cannot cause cancer, and this is why. The theory that toxins cause cancer is based on the assumption that cancer is a malignant disease. But if we learn that cancer is not malignant but a meaningful biological process, then we also understand that toxins can cause cancer. Also, when we learn to understand that cancer originates in the psyche and that each cancer is controlled from a very certain area in the brain that acts as a mediator between the psyche and the body, then we also understand that toxins cannot cause cancer. Dr. Hamer's discoveries also explain why people that live a very healthy lifestyle, that follow a healthy diet and try to stay away as much as possible from toxins still get cancer, and this often at a very early age. I know this is something to digest, but we just have to look at the science.
Let's take cancer, okay? So the GNM definition requires a conflict shock. So actually the process of smoking or, you know, being exposed to these toxins itself doesn't cause the shock. So the shock is what is required, is clearly defined in its biological laws that the shock is required. Now, not to say it's not going to interfere with and inhibit the process from running smoothly, so it could be working against the process.
The smoking.
Smoking or other forms of toxins. So, you know, they're not going to be good for you.
And anything that's putting stress on our system really is taking us out to the non-stress, isn't it?
So the toxins are just a slight nuisance because the body's not running at its optimum performance, therefore it could hinder this natural process.
Yeah.
That's what you're saying.
Exactly.
Right? Yeah. But it's not the toxins which actually cause the cancer or the disease.
No. So they may, for example, inhibit the ability to resolve a conflict because your body's not optimal. So in that sense, it could prolong the active phase and the healing phase correlates to the active phase, the intensity and the duration.
Right.
The longer it goes on and the more intense the active phase, then the longer and the more intense the healing phase will be, for example.
Right.
So if you've got toxins interfering with your natural body processes, then they can make it worse in that sense.
All right, well, Caroline talks about lung cancer in this clip.
So he found, for example, that lung cancer is always controlled from a very specific area in the brain stem, which is the oldest part of the brain, and that lung cancer is always linked to a death fright conflict.
As well as toxins, there are certain things which allegedly increase the risk of diseases. So you wanted to mention something about that?
Yeah, well, the same as toxins, really. Things can't increase your risk of cancer, a bit like Lloyd said. So say for example, you know, if you have like a restrictive bra on and it's blocking the lymph flow, that could hinder the healing and stop waste from exiting and things like this. So there are things to consider, but the risk factors really, from a GNM perspective, a risk factor would be in a sense your susceptibility to actually experience the DHS.
Right.
So, for example, if you were highly stressed and highly strung, or very sensitive and took a lot of things personally, easily offended maybe, you could be more likely to experience a DHS. And so that to me is a kind of GNM perspective on a risk factor of cancer, but that's the only way that really that it would come into it. But there's also, as far as things like smoking and toxins and things like that, fewer of them could actually cause a DHS, and the belief that they will. So, because the bus stop signs, wasn't it?
Yeah, well, recently we've seen obesity causes cancer on the side of bus stops, and people may have been obese for many years, but, you know, could that be
so I mean, seeing that advert that's telling you that if you're obese, you might get cancer, that could trigger it.
It could trigger a DHS
if you were a very sensitive type of person.
And if you had a fear of cancer, you'd think, whoa, I'm obese, that's it. You know.
Makes you wonder if they already know that.
we that had crossed our mind. Okay.
All right, so in this clip, Caroline talks about cervical cancer.
Let's look at the cervix. The cervix is the passageway to the uterus. And Dr. Hamer found that the cervix, or the conflict linked to the cervix, is a sexual conflict of not being able to mate. While in nature a female can suffer such a conflict if mating is interrupted or doesn't take place for one or the other reason. Well, if this is the case, the cervix, the passageway to the uterus, immediately starts to ulcerate, causing tissue loss. And the biological purpose of the tissue loss is to widen the cervix, so when mating finally takes place, more sperm can reach the uterus, which enhances the chance of conception. Dr. Hamer found that we women, or women in general, can suffer these conflicts as well. So for us, this translates, for example, into sexual rejection, sexual frustration, sexual abuse, or anything shocking in regards to sexuality. So we see that tissue loss serves the purpose to facilitate the conflict resolution.
I think we've hinted at this throughout the interview about metastasis, right? So typically you'll be diagnosed with a cancer, and a lot of people, they get what's called secondary cancer, right? And often it'll be a completely separate organ. So tell us what mainstream science says about how that happens, Lloyd.
Okay, so mainstream will say, okay, it's gone to the such and such organ. Regarding, say, there was a breast cancer initially, and then got into another organ such as the lungs, bones, lymphs, or something like that. So what GNM says is that the cancer cells, this in a particular germ layer, they're on a particular organ, or they're in a particular organ, cannot transfer to a different germ layer. They're running a biological program. So GNM says you cannot have metastases. So how it explains it is that you're getting secondary cancers from diagnosis shock, for example, or several others. Danielle, you've got some more examples.
Yeah. So when you are told you have now got cancer and you might die, that causes another DHS, which gives you a completely different type of cancer.
Yeah.
And medical science says, well, some of the cancer cells escape and they go through some means to this other part of the body, and they give you a completely different type of cancer.
Yeah.
And there's no mechanism that they've got any proof of for that happening.
That's right, yeah.
It's based on an assumption, basically.
Well, let me just...
It's a hypothesis.
The metastasis, okay? Anyone who can provide any evidence of metastasis, we've got... one of these will be winging its way to you as a prize, because apparently they don't even screen blood for cancer cells.
No.
Well, this is one of the questions. I mean, you look at the two transport systems, and there's the blood or the lymph, which is what they claim in the mainstream, that it'll travel by the blood or the lymph. So
lymphatic system.
the lymphatic system, yeah.
So the cancer cells somehow cancer cells break away from the tumour, they go through the blood or the lymphatic system, and then they find their way to another organ, and they go, right, lads, we'll have a bit of cancer here as well. That's.
So, but the questions that raises is, why are no cancer cells detected then in the blood as it's going around the body? And if they were, wouldn't they have to screen the blood transfusions? Couldn't you catch cancer off somebody if you touched their wound, you know? It raises so many questions.
Yeah,
and wouldn't the cancer just sort of affect the blood vessel or the heart or the nearest organ rather than go into a particular organ, you know?
And the other thing is that the type of cancer, the secondary cancer is cell loss.
Yeah.
Whereas the first cancer was cell proliferation.
Yeah, so it acts completely different.
So it's got a completely different modus operandi.
Exactly, yeah. So how could a tumour being grown go into the bone and then that is cell loss?
Yeah,
it just doesn't make any sense.
Like a glandular breast cancer would be cell proliferation. And then if that goes to the bone, like the ribs or the sternum, because, you know, that's often what happens in a secondary breast, the breast cancer, secondary to breast cancer, then it becomes cell loss. It just doesn't make any sense that it would act any differently.
So the first thing really that people need to do is come to terms with the fact that if they have cancer, it's not going to harm them, and believe that. And believe that it's not going to trigger a secondary cancer, and that your body is going to naturally deal with it. And if they can believe that, they'll probably never have any cancer problem ever, right? So it's about changing your perspective, being a bit thick-skinned and quite laid back.
Yeah.
Certainly, yeah. I mean, you're not going to stop having DHSs. This is what Dr. Hamer said. Yeah. But it's just your ability to deal with them and for them not to turn into serious problems. I mean, we often heard actually years ago in the natural health field, if you like, that the body's always going in and out of cancer. And we thought, oh yeah, that sounds interesting, as if it's like they detected small amounts of cancerous growths, but it never amounted to anything. But this explains that beautifully, because when we heard that before, it didn't really take away the fear. It was still, yeah, but what if one of them was to grow? But now we've got an explanation for the sort of whole process.
Right.
This has been the most empowering part of this, actually. Yeah.
Right. I mean, perhaps viewers can identify people who they know who've had either cancer or other serious diseases, or even themselves, and think back to maybe 1, 2, 3 months before, or even up to a year, let's say. Yeah. Can you identify a serious conflict that you've gone through before the disease you've had any symptoms? And if any viewers can, then let us know, and I can perhaps cover that in a future show. Yeah. So in the news they're telling us that more people are getting cancer today than ever before. So how does this explain that then? Is it just because
are they? Or are they just getting detected more?
They're just getting detected more because they've got this scanning program. They're wanting people to go in for tests more and more, so that will increase the amount of diagnosis.
And also, it would increase the DHSs, so it could, in effect, increase the cancer rate in that way.
Yes. Yeah, German New Medicine will state that we may have had cancer several times in our own lives and not known it.
Yeah.
Right. So obviously, if you're going to go to regular screening and then it gets picked up, it's going to give you another shock. Yeah. And they might start giving you harmful therapy for the thing that's healing itself anyway.
Yeah.
That's what you're saying.
Yeah. Armed with GNM, you'll interpret medical scans in a completely different way now. So hopefully it'll take away the fear. It'll reduce your fear of a diagnosis, which is based on, ask yourself what it's based on and do some more research on what the prognosis is actually based on.
Right. Now, some of these diseases would be considered hereditary.
Okay.
And how does German New Medicine explain that?
Well, so hereditary, they're talking about things like, say, the BRCA gene with breast cancer, increasing the likelihood. So what the German New Medicine perspective is, no, cancer is caused by a conflict shock. So were you talking hereditary? Are you talking about just coming from the same family, the same upbringing, same religion, culture? So if you have a similar conflict shock occur, then you're probably more likely to experience or perceive that in the same way and get similar conflict shocks to your parents or the members of your family. It's not so much genetic, it's culture, family,
it's more
history.
beliefs.
It's like if something happened to your mother or someone else in your family, you are going to have that in your mind, and you're going to be a sort of like a diagnosis shock is going to be putting you in the frame of mind, someone in your family had breast cancer or...
So you're saying that maybe that you're learning to be more like your parents as you're growing up in the mind, so therefore you would be susceptible to the same...
But also the same upbringing, the same culture, religions and things like that. I mean, I'd be interested to see if Buddhists who, are less likely to have death rights because they, believe in reincarnation, for example. So, that would be an example of a completely different culture, stroke religion, that may have completely different...
I did read that there are certain ways of assisting the programme, with diet, for example. Just tell us about that. Yeah,
well, there are things to consider with foods when you're in the healing phase. So an example is if you're getting night sweats and you're in an old brain program where tubercular bacteria is going to be involved, they will use up an awful lot of protein. And if there's no available protein, they will take the protein from your own body. And this is why we see people with cancer kind of wasting away. Is the protein loss that they're suffering from, and this can be very, very serious. So it's really important, especially in that first part of healing where the bacteria is involved, to increase your protein intake quite considerably. Have a lot of protein. And in the alternative field, what you see in this phase is a lot of people saying, oh, you've got to go vegan, and red meat causes cancer, and this and that and the other, we've got to do this juice and fast and things. Well, in that particular program, that could be extremely detrimental.
Right, yes. So I was going to ask you about other alternative medicines. So we've got, for example, the sodium bicarbonate to kill the fungi. I heard that in one of Caroline's lectures, she said that the guy who came up with this idea of bicarbonate to put on tumours is that he's right in identifying the fungi with the cancer, but he's wrong to try and get rid of the fungi.
Yeah, so he's cutting people open, or when they're having surgery, and he's noticing this white candida sort of like fungus surrounding the tumour, and thinking it's a cause, and no, it's actually that is the process of the body breaking down and helping to get rid of that tumour. So he's associating a symptom as being the cause there.
Right.
So obviously by using sodium bicarbonate and alkalizing is another kind of example of thinking, oh, it's an acidic environment or it's got the fungus. You're interfering with the body's natural processes there.
And actually the acidic environment for microbes is really essential for them to thrive. So that's another sort of thing that people say in the alternative world is you need to alkalize your diet and alkalize your body. But if you're in a healing phase, you actually require that acidic environment especially in the first part.
Yeah. Really with these, if you view them again with the GNM perspective and you use them wisely, but the bicarbonate when there's fungus, for example, if that's going to kill the fungus, which is doing its job, I mean, what's going to happen? It certainly hasn't finished the healing phase. Right. So even if you get rid of that and you set it back and you go back into the active phase, for example, or you're resetting it, it's likely to come back, because the bottom line is if you haven't completed that healing phase properly, then the program hasn't been completed and you're going to get problems coming back.
What about Gerson diet and the Huxley cure as well? Because Huxley was curing hundreds of people in the 1950s, I believe.
Yeah, well, the Huxley is it, and Essiac, Rene Case did the Essiac Indian herbal tea as well. So they based on similar Indian herb combinations. But he had a therapy to go along with his as well, which is a bit more like the Gerson with the detoxing. So as far as the herbs are concerned, now they will help to eliminate you know, so the tubercular bacteria is breaking down a tumour, for example. We're still talking about a cancer which has been grown in the active phase and then getting rid of in the healing phase. So all that debris has got to go. Now, lymphs is one of the main systems in your kidneys. Now, these herbs are very good for keeping the lymphs flowing and clearing the kidneys. So they're basically giving an escape route for all of this debris. So it's very, very assistive of the healing phase. For you know, so that might appear to accelerate the healing phase compared to normal. So you're seeing great results when you go on those herbs compared to, it might take longer if your lymphs are a bit blocked or your kidneys aren't optimal to get rid of this otherwise, and it would have lasted around a lot longer maybe. So they're not cures, as GNM doesn't call these things cures, but they assist in
the healing phase.
Yeah.
So there are certain things you can consume which might assist the healing phase, one of which is protein, but you've got to take it at the right time, I guess, and the herbs as well. All right, and what about cannabis? Because obviously cannabis can make you a bit more laid back, can't it? which might make you consider some of these conflict shocks not so much a conflict.
Yeah, there's definitely that angle, isn't there?
Change your perception on things, wouldn't it? Cannabis and CBD is actually very supportive to the healing phase because, and it's also very helpful because it's got like the pain relieving properties, and it helps us to stay in the non-stress state. So it's actually really quite supportive.
Right.
So whether that's CBD or full cannabis.
Right. And which are natural things. They are trying to bring cannabis into a prescription drug, aren't they?
Right.
Not only does the GNM give a completely new perspective on disease and what disease is, but it also kind of explains how some of the alternatives seem to work and why they work.
Yeah. I think it'd be super powerful to use some of the alternative therapies we're familiar with the GNM knowledge. So you're only using them in a phase where it'll be appropriate.
Right.
Yeah.
So it's got that extra thing. So just to recap, your toxins don't cause cancer, and the natural things, you know, for years we believed now that they did, but they themselves don't cure. But as long as they assist in the healing process, then they obviously are going to still be beneficial. So we're not dissing that. This is our business for the last 15 years, you know, just using them wisely.
Right.
Yeah.
And you mentioned sugar, Danielle.
Yeah, it's a lot of people are saying that sugar feeds cancer cells. Well, it does, but it also feeds every other cell in our body. So, and as we know, cancer cells are just these temporary cells. But what you need to be careful of, and this is something that I've experienced, is that, I mean, I went without sugar for so long, for quite a few years. And you can actually, if you make an enemy of a food, you can actually create an indigestible morsel.
Right.
So this is where, like, you know, kind of the intolerance, food intolerances can come in. So every time I'd have something accidentally and I realised I had sugar and I'd swell up like a balloon.
Right.
Well, now I understand this. The swelling has stopped if I have something with sugar in.
Right.
So it just goes to show that you can actually create an indigestible morsel for yourself. So it's not to sort of make any enemy of food. And I also wanted to say about the toxins not causing cancer. Things like artificial sweeteners, okay? So whereas they cannot cause a cancer because there's no DHS involved, they're a poison to our system. Physical poisons such as artificial sweeteners and chemicals in our food and things that we're not, you know, that we're subject to, they can cause symptoms in absence of a DHS. So they're not going to actually cause the cancer program to run, but they can cause us symptoms and they can cause cell damage.
They're basically putting the body under stress, aren't they? Which is against the process of the...
Right, you just mentioned something there, causing a program. Now I've made a note here. I've said, assuming all this is true, that there is communication between a specific part of the brain and the organ which gets the tumour, right? Has this knowledge been used nefariously, perhaps? In other words, is there a way to artificially create the same communication in the nervous system or in hormones to trick the organ and the psyche, or to trick the organ into thinking that your psyche has experienced a conflict. Do you see what I mean? Can it be hijacked, right? And could it be used as a murder weapon? That was the question I was going to ask.
Well, it's certainly something that Dr. Hamer hasn't done.
No, I don't expect he would have.
No, it's something that has crossed our minds, you know, the biowarfare thing and that, yeah.
So J&M talks about heart attacks, and I was quite surprised by this because I learned that heart attacks are not caused by the arteries being blocked by cholesterol, but cholesterol does play a role in the heart attack. So there's a few lectures by Caroline that you can go and watch from her website. Now there are two different types of heart attack. From my reading of it, a heart attack is far more difficult to prevent than getting over a tumour, because the heart attack occurs here at this point.
Yeah.
Yeah.
And I don't know whether we've got time to go into heart attacks today, but just to summarise, they're generally caused by territorial conflict. Yeah, that's all. That's one of the conflicts.
Yeah.
And depending on how long that conflict goes on for, when the conflict active phase finishes, it's maybe a week or two after that you get the heart attack. So you get the heart attack in the healing phase. Right, that according to German New Medicine.
Yeah.
So, and I guess there's very little you can do about it if it's on its way.
Well, there's if you're still in conflict active, this is where it's good to know this information, because if you know you're conflict active and you know you've suffered a territorial loss conflict, which is related to the coronary arteries, then you can work to quickly resolve that. If it's active for more than 9 months, then the heart attack is more likely to be fatal.
Right.
So if it's a short, if you can make that conflict active as short as possible, then the heart attack would be less likely to be fatal.
Right. And just to explain, that the part of the brain which is associated with the coronary arteries, right, which is involved in this type of conflict, you've got some activity in the coronary arteries itself to do with the cell walls, which happens when you're in conflict. So there is changes within the coronary arteries while you're in this conflict active phase, which is usually some sort of territorial thing going on. So there's changes in your coronary arteries. I'm not sure whether it's a depletion or an addition.
It would be a cell loss.
Cell loss.
Yeah.
And then you resolve that conflict, and then at this epileptoid crisis phase, bang, that's when you get the heart attack.
Yeah. I mean, there's one to get warned strongly about in the lectures, and when we went over there, that actually is one of the things that Dr. Hamer said in this circumstances have been going on for a long time, many months, like 9 months, given the example.
Yeah.
It's better not to resolve these. If there's any.
Right. So if someone has been in a territorial conflict for 9 months or more, something that's really bothering them, they can't sleep at night, and it's over territory. I mean,
like neighbour issues.
Neighbour issues, like getting banned from the pub. Right. So something which is really important to you. For example,
I'll just add retirement to that.
Retirement can cause it.
I think that has been mentioned as
business merging, and that's your territory, that your job, and you know.
And if that's been bothering you extremely badly, and you've not downgraded it, you've not started to deal with it, and if it's gone on for 9 months, the changes in the coronary artery are such that when you get to this epileptoid state, the heart attack is so large that it will kill you.
Yeah.
Assuming it's true, it's mind blowing.
It is.
Yeah. So in that circumstance, you would not look to resolve the conflict. You would look to downgrade the conflict.
Right. So,
because you can live with the conflict forever, you know. But
it's
not nice.
Sometimes a conflict can be resolved against your wishes, though.
It can, But we can't.
So
really
something might happen. You might get a windfall. You might get money. You might win the lottery, and that would cause a heart attack. So you say you've had your property taken off you for whatever reason, and then that's gone on for a year, and then winning the lottery could then cause a heart attack, couldn't it?
If it was that particular conflict,
So you just,
yeah.
Yeah, I mean,
so that's what I meant when I said, well, a heart attack is this type of conflict is far more potentially dangerous because it's going to trigger a heart attack from a novice, from someone who's new to this.
Well, it's something that we were warned against in the conference, and I think if you've got a clip of Caroline to emphasise this, then yeah, it's fascinating, and again, there should be correlation that, let's say, mainstream are able to observe that would, either confirm this, corroborate this, or deny it.
So when they do a post-mortem of someone who's had a heart attack and they find cholesterol or whatever in the coronary arteries, it's been put there because of this conflict.
The cholesterol is actually produced to help to heal the blood vessels.
Right. Yeah.
A bit like the bacteria would in the.
If people want more detail, they can watch Caroline's lecture.
Yeah.
Let's come on to viruses now, because I think many people will be able to accept that cancer or a tumour is started internally. It's not something that's come from outside. It's not a physical thing like a microbe that's come from outside that's caused it. I think even standard medical science says that it's an error, right? So in other words, it starts internally, right? Now with viruses, they are alleged to start externally. So it's something which has come, a foreign body which has come into the body, which then multiplies. And I think GNM has a completely different view on viruses, as far as my understanding goes. And in one of Caroline's lectures, she explains how Louis Pasteur was a fraudster, and some of his results, his science has been disproven, apparently. Now, Dr. Hamer believed that the ectoderm germ layer is related to the areas which are associated with viruses. Did you want to say something about that?
Yeah, well, the ectoderm is where you'll see the evidence on the skin. So if you get outbreak of spots, for example, then that's where they're appearing. Now, but again, is it a cause or is it something that's present? So he actually didn't find evidence of the existence of viruses, and when you look into virology, the evidence is all based around antibodies and antigens. It's not, they haven't actually isolated the virus. Now, there's books on the subject. I think Virus Mania is the one that they reference on the website, and even someone's done a court case.
Virus Mania. Right. Okay.
Yeah, and there's even been a court case where someone has asked for evidence, and undisputable evidence, of the existence of viruses.
Measles, wasn't it? Measles in particular.
He won, then he went to another court, and apparently they found in favour of the guy who basically collated together several kind of existing documents and said this is the evidence, but he was very specific. It needed to be isolated, like image of an actual virus itself, not the, not proteins or that'll be associated with it, or evidence like antibodies. It had to actually be very specific of an isolated virus, basically. And in the end, the Supreme Court found in his favour that there wasn't the evidence that he'd asked for.
Let's have a look at a short clip of Caroline talking about alleged viruses.
And all this ectodermal tissue, which is derived from the youngest germ layer, are therefore controlled from the youngest part of the brain, which is the cerebral cortex. But Dr. Hamer first theorized that viruses must be the microbes that assist now the healing phase of a cortex-controlled tissue. But Dr. Hamer made a significant discovery. He found that all these cortex-controlled tissues, whether it's the skin or our nasal membrane or the bronchia, heal without the participation of microbes. So Dr. Hamer wondered naturally that maybe viruses are not even present in the human body. But based on the genetic system of microbes, he proposed that if viruses were present in the human body, then viruses would, just like TB bacteria and fungi, assist the healing process, in this case of cerebral cortex controlled tissues. So at this point, he left it open, but the fact is, if viruses were present in the body, then the hepatitis virus, for example, would assist the healing of the liver. The herpes virus would assist the healing of the skin. And an influenza virus would assist the healing of the nasal membrane. So this, of course, opens a completely new debate about viruses, and if viruses are in fact the cause of AIDS, for example, or of hepatitis, or of cervical cancer, of SARS, or of the flu, like the swine flu, right? It also challenges, I should say, the conventional understanding of epidemics and of pandemics. For example, of the Spanish flu epidemic, of the lung tuberculosis epidemic that occurred, both of them occurred at the beginning of the 20th century. It also questions the cause of the AIDS epidemic and, of course, of the purported threat of the swine flu, so to speak.
My understanding of catching a cold, for example, is that you'll be next to someone and they might sneeze and you breathe it in. So that's not how it works then. No. So just fill us in on that.
Okay, so a cold, common cold, is caused by a stink conflict. So it's something that, any conflict surrounding a stink. So if you believe you can catch a cold and somebody sneezes next to you, right, then it can cause a conflict then. You can think, oh, I'm going to catch this cold now. I don't want to smell this sneeze in. Right. That is a stink conflict.
Okay. Some people might have difficulty accepting that. I think I think what we've discussed so far might be a lot of people will be okay with, but to say that viruses are not contagious, is that what's being stated here?
Yeah, well, I mean, just using the cold as an example, I mean, isn't it possible to develop a cold when you don't come into contact with anybody? So it's...
And not to have a cold if you're sat next to someone sneezing.
Right.
So the mainstream concept of breathing in germs and catching a cold doesn't explain that, but G&M does, because if you don't believe you'll catch the cold, then you're not likely going to have the stink conflict.
So what about large-scale epidemics and pandemics?
Well, she mentioned the Spanish flu as an example, so if I just build on that. So that was at the end of the First World War, so obviously there's been a huge conflict going on in everyone's mind, which was the war, and the death rate was the people are going to come home alive, the soldiers themselves and their wives, for example. So that particular epidemic was this claimed epidemic, obviously was prevalent in 20 and 30-year-old people in their 20s and 30s, which would have been the soldiers and their wives mainly. Mm-hmm. So
it's originated in the psyche because of the war?
Because of the war, yeah. So just remembering now that it's going to be the conflict resolution when the symptoms are going to occur. So what we've got is en masse, the end of the war, and troops coming home, or if they've died, then it's still the end of the war, the end of the conflict, and en masse, millions of people are going to be experiencing a very similar conflict.
Right.
Resolution. Right.
Yeah. Resolution. Sorry.
What about in peace times when we haven't got war? So would that happen when England get knocked out of the World Cup or something, or?
I suppose if people.
I'm making light of it, but
yeah. To a small extent. I mean, actually, something you brought up in the conference, wasn't it?
It was about Brexit.
About Brexit.
Yeah. I wonder how much, if the people are really fuelled and fired up about it, when this finally resolves one way or another.
Right.
I wonder if there's going to be some sort of apparent outbreak.
So let's just say that there was a hard leave, and all these people would be celebrating, let's say, which they probably would, they could all come down with something. That would be your prediction.
Yeah.
And it would be described as an epidemic.
They would have to be that emotionally embroiled in it in order for it to be, if they're passionate, so passionate about it,
That they would be the ones who would be more susceptible.
We predict the Brexit flu. I mean, one way or another.
Flu.
One way or another.
Well, get something on your website to sell Brexit flu. Yeah.
We'll create a vaccine.
Well, yes. Which brings us on to vaccines. I still have difficulty with the concept that viruses aren't transmitted from one person to another, and that's not the cause of the disease. But that's generally what this is saying, is it?
Yeah.
So there's another mechanism by which the symptoms occur other than being passed physically through fluids.
Do you want me to give you an example of a measles outbreak in a school?
Yeah. A measles outbreak in a school. So we think that that's passed from one child to another. What is it? I'm not sure with measles. Is it airborne or? Well, I'm talking about mainstream.
Yeah.
Okay.
So measles is the healing phase of a separation conflict.
Right.
So, say for example, this is how it could play out, okay? So you've got a class and the teacher goes off sick or is not in. So some of the children could have a separation conflict, which would trigger off the program. Then when the teacher comes back, the conflict's resolved and then they get the rash.
Right.
Okay?
Right, go on.
That's stage one. Okay,
right.
So they're kept off school. Then their friends then could miss them and have a separation conflict. Even, the adults saying, you can't play with this person because they've got measles, you're going to catch it. So there's, number one, there's the fear of catching it, which is making you more susceptible to the DHS. And then there's the other thing is they're separated from their best friend. And young children, they will take this to heart. They would, it would cause them to have
for me, a much bigger separation conflict is not being with your mother or father when you first go to school. I remember I spent one day at school. I was 4 years old, and my mother couldn't get me to the second day. It was a physical fight with my mother, and she couldn't catch me. I remember I was really, really upset. I would not go to school after I'd experienced one day of it. That was a very traumatic day. Now, I can't remember if I got measles a bit when I'd come to terms with it. I know I have had measles, so I didn't keep a diary.
It'd be interesting, wouldn't it?
Yeah, I didn't keep a diary.
I was thinking more of that's extremely valid, yeah. I was thinking more of because that would explain why more than one child at the same time,
Yeah.
And then it would just have a knock-on effect because they're separate from their friends, or they're told they can't go to school because there's this measles epidemic. And
right.
You know what I mean? So you can see how it could play out.
So that brings us on to vaccinations, because obviously if that's the case, then they're pretty pointless, yeah?
I would say so. Yeah. Well, I'd put it this way. Our knowledge of GNM has cemented our previous opinion on vaccines.
Right. Knowledge of GNM has cemented your previous opinion on vaccines, right. And there are other things in vaccines other than the vaccine, other than the agent.
Exactly.
There's all sorts of stuff in there, which Caroline explains some of it is not good.
No. And there's as I think has been mentioned, the process of actually getting the vaccine, which could involve restriction of the child. So, some of the adverse reactions you're seeing could be, think like along those lines as well as the actual toxins being injected,
Right. Now, we are going to come on to mental disorders in a moment, just briefly. So, you mentioned autism, because viewers may be aware of the work of Dr. Andrew Wakefield and his research about autism and vaccinations. So you wanted to make a point about that?
Well, yeah, there's actually an autism constellation, which is when two conflicts are active involving both hemispheres of the brain.
Right.
So it could be that the vaccination process of the child has activated those two conflicts.
Right, I see. So the whole thing is fascinating, and as I mentioned, German New Medicine also claims to be able to explain mental disorders, so-called disorders. Let me give you two examples from German New Medicine. One is ADHD in children is caused by a feeling trapped conflict. So that seems logical. If you're going to pin a child down and say, can't run about or can't do this, and the child is aware of that, then that could cause ADHD. That seems logical to me. And also, obesity in children is caused by an abandonment conflict, according to German New Medicine. So things like obsessive compulsive disorder and the huge long list of 3-letter mental health conditions, could they all be explained?
Yeah, like you say, it's a very complex topic, yeah. But there's what Dr. Hamer termed as schizophrenic constellations.
Right.
Like I explained, there's 2 conflicts that are active, involving both hemispheres of the brain.
Right.
So depending on what those conflicts are, would depend on the constellation, and therefore on it covers personality traits and mental disorders as well.
Right, and obviously we've covered the subject of mind control on this program before, and one would imagine that if organizations, nefarious organizations, the CIA or whoever, they may well be aware of all of this if they're trying to induce this sort of thing. And we also have NLP, neuro-linguistic programming, who have, am I right in thinking, cherry-picked from some of Dr. Hamer's research?
Yeah,
do you want to just mention that, Lloyd?
I think it is kind of what I mentioned earlier about plagiarism, is where they've obviously taken some parts of his research and mixed it in with another modality that they're already doing. So, I think it's important to portray Dr. Hamer's work as he discovered it, and like we do with kinesiology, we kind of integrate it a little bit because we find it beneficial to complement it, but it needs to be, taught and passed on in its original form, and obviously acknowledged in Dr. Hamer as well. So some people are taking these other techniques, giving them a completely different brand name. It's obviously ripping off his research, but they're not even acknowledging him. They're just trying to pass off as their own research and that,
Right.
Yeah, go on.
So we're coming towards the end now. So if either of you got cancer, what would you do?
Well, I've already had a journey myself, which I didn't have an official diagnosis for, but I had a large lump in my breast. This was in 2016. When I've gone back and analysed the journey from a GNM perspective, due to the symptoms that I had and the conflict that it involved, I know it was a glandular breast cancer. And because I'm a kinesiologist, we obviously used muscle testing then to as a way of tapping into my body to see what nutrition, herbs, supplements and things that I needed. So I didn't know GNM at the time, but because I was using kinesiology, I think it seemed to sort of go quite well, and the lump eventually sort of went. So I think that if it happened now, we'd pretty much do the same thing, but we wouldn't be afraid like we were. I mean, we were really scared at the time, Right. And this is why I was so scared then when I had that high risk scan results. But I realised then that was just the end of the activity that was going on because the lump had gone.
Right. But I presume now you would try and identify the various phases and see if there's anything.
We'd use it all with a GNM perspective.
Right. And take extra protein at the right time and whatever else.
All of the things, the beneficial things that we mentioned, herbs and all that, obviously going to be important to support you in the phase. It's supporting the support system then, and certainly it does take away a lot of fear, and certainly for anyone who wants to look into this, if they then at the first, because to be honest, people are rushed to making decisions as if things are very urgent, as if they say it was tumour's grown over several years, but you need to do something about it in a very short space of time. Right. Then, while they're weighing up their options, certainly look into this and see if it correlates. And then if the rest of it correlates, then, have a bit of faith that to support themselves.
This is what often happens. People will get diagnosis, they'll go to the NHS, and they're not quite happy with it, so they'll then start looking at alternatives after they've been diagnosed. And by the time they get the knowledge, in some cases, it's too late. This is, well, it's not what happened to Dr. Hamer, but if you think about it, right, he only started seriously thinking about it when he got cancer.
Yeah. Yeah.
So even though he was a cancer doctor, he wasn't applying himself in his maximum capacity to solving that problem until he got the cancer. That was when he started looking at it, because he's trying to save his own life or find out what's happened to him. It's affecting him personally. And this is what happens, I think, with people when they only start looking into health once the health.
Yeah.
But knowing something like this in advance, it can,
Exactly.
you know, it's like
that's what I was going to
it's
say.
true prevention, isn't it?
Yeah, yeah. So it's all about changing your core beliefs and how you emotionally react to things that are going on in your body, and your understanding of it itself.
Just seeing it as something to fight. If you think you've got to fight it, and that mentality.
That itself is stressful, isn't it?
Itself, you know, just that simple, basic thing at the beginning, the underlying, you know, concept that you want to support yourself or you're fighting yourself. I mean, what state of mind does that put you in? Yeah.
At a certain point when you're in the healing phase, you're going to feel tired, you're going to feel fatigued, so you lie down and you take protein or what have you. So you're not fighting it as such. You're helping a natural process.
Yeah, yeah.
Right.
Yeah. It's like the symptoms that your body's giving you is almost telling you what to do, aren't they?
Yeah. Yeah.
And I'll just give one more thing to talking about that. Another statistic from Dr. Hamer is that the 92% we mentioned earlier, the 6,000 out of the 6,500 that recovered, he estimated that the success was more like 98% for those who hadn't undergone conventional, let's call it, treatment, mainstream treatment, so the chemos, etc.
And he said the only reason it wasn't 100% to his belief was that he couldn't get the fear out of the last few.
The remaining 2%.
Something I just want to throw in about fear and about it's not really linked to German New Medicine, but I went to see Rupert Sheldrake last week talk, and he was talking about, because obviously we've been talking about things that impact on you negatively. Yeah. So something happens, you get your house taken off you, you get divorced, someone dies. These are conflict shocks as you describe them. Now, when I went to see Rupert Sheldrake, he was talking about how to positively impact your psyche. Yeah, and he said they did an experiment where they asked so many people to write a letter to someone who had helped them throughout their life and thank them. Yeah, send that letter. And they had a group that didn't do that. They monitored these people, and it gave them a far more positive. They felt better about themselves for 2 whole months because they'd thanked someone. And then he talked about, well, nobody says grace at mealtimes anymore. And he said that people who are grateful, they tend to be more popular, which makes them more grateful. So it's like has a sort of positive feedback effect. I mean, I don't describe myself in that group particularly. Maybe it's something I should work on. But what I'm trying to say is that that good deeds, let's say, doing good deeds, thanking people, and having that sort of outlook is the opposite of getting the conflict, isn't it?
Yeah.
So that would presumably would improve your health, which it does.
Yeah, so it's like people who are complaining all the time, they tend to have more problems.
Yeah.
And it might sound a little bit new agey, but we do have to be careful of our inner thoughts as well and what we're telling ourselves, you know, because, you know, Dr. Hamer found this self-devaluation conflict that can cause chronic conditions like arthritis and fibromyalgia and things like that. How many people are suffering with these things?
Yeah.
And it's all to do with self-devaluation. And, you know, so, you know, just by correcting your inner thoughts, making them a little bit more positive and understanding and having more compassion for yourself. There's not very much self-love. And like I say, it sounds a little bit new agey, but you can understand how important it is when you understand Dr. Hamer's work.
Yeah. Now, if you want to just go to the website, it's learninggnm.com, and just click on the index. Right, you go to the first menu, click on index, and you just have a look at how detailed this website is. Right, it's got a huge index, and it's goes through every organ, every part of the brain. It's far more detailed than we could have included in today's discussion. All right, so thanks for coming in, both of you. And just to tell people about your own website, Give it a plug.
Thank you.
Shopholistic.co.uk.
Yeah.
.com.
Come on.
.com.
.com.
Shopholistic.com now, Richard.
Come on, Lloyd, sell it.
Shopholistic.com.
That's it.
Yeah.
And your other website?
Oh, and I got Lloyd's Bits as well. Thanks for plugging that in your newsletter.
Yeah.
Bits stands for Bespoke IT Solutions.
Just in case.
You've set up a Facebook page for anyone who wants to come and discuss today's interview or any other issue about German new medicine. Danielle, tell us about it.
It's called German New Medicine. It's on Facebook. So at the moment, it's German New Medicine, GNM, UK Community.
Right. German New Medicine UK Community, and they'll find that on Facebook. Yeah, and on the Facebook page you can read Danielle's article about the upcoming Brexit flu.
Okay, yeah, and also you could go onto my blog website, which is daniellebryant.co.uk.
Now, Danielle and Lloyd will be hosting an event in Caerphilly for anyone who is interested in learning more about German new medicine. It is at the Bedwars Workman's Hall on Sunday the 22nd of February, and it starts at 12 noon. You can find out more information from daniellebryant.co.uk. There's also a GNM conference planned for the UK featuring Caroline Marcolin. The venue is to be arranged, and that will take place in October sometime. Forthcoming details can be found at learninggnm.com. So just to finish, we're not saying do not go and see your doctor, and we're not saying do not listen to your doctor's advice. I think what we're saying is that if you have health problems, go to your doctor, listen to their advice, do your own research, and decide for yourself what is in your own best interest. Yeah. And believe none of what you hear, including from your doctor, and only half of what you see. I'm Richard D. Hall. Good night.